Hi, I'm doing the benchmark ethical dilemma presentation assignment. Um, yeah, so in the situation that we had a husband coming into a counseling office, and he was a client, and he comes up to the receptionist and he tells the receptionist to give information that he had to his wife, who also was a client. So yeah, so that's where it starts. It said the wife, upon receiving the message, was uncomfortable because her husband knew she was in counseling. The problem was that the receptionist gave information of the identity of other clients. It was an ethical problem because it breached their confidentiality. Applying the ACA Code of Ethics, the ethical situation corresponded to the ACA Code of Ethics B1C, which deals with confidentiality. The receptionist was not allowed to give the information only if there was informed consent or a legal issue. The ACA Code of Ethics B1D also applies a limitation. This applies because sometimes confidentiality can be breached if someone is a threat to themselves or others. Another ACA Code of Ethics is B2E, which is minimal disclosure. The client and counselor would need to decide which amount of information need to be shared, while a receptionist would not be allowed to share that information. The applying like state codes and laws and federal mental health laws. In Georgia, there's a state code, 135.7, 3 of confidentiality, and 2A, this involves revealing the confidentiality of client. This means keeping information from associates. Um, Federal mental health rules found in Part 2 of Confidentiality 2.2 of Purpose and Effect B1. It talked about disclosing information if it was a legal matter, but in the case the receptionist did not have the legal right to share this information. Determine the nature and dimension of the dilemma. Autonomy was breached in this situation. The counselor and client needed to decide what the client wanted to share. Confidentiality was also breached in this situation. The counselor had the commitment to keep their client's information safe, but they did not keep it safe. They needed to respect the client's boundaries. Fidelity needed to be implemented, so there is a commitment. Some counseling associations that would be helpful is the National Board of Certified Counselors and the American Counseling Association. General potential course of action. Some actions in response to the video would be to look at the ACA Code of Ethics for guidelines. I would also ask a colleague to help deal with the situation. I would tell the female client that the information that is shared in the sessions will not be shared with her husband, who is also a client. I would talk with the receptionist and remind her of the confidentiality that is important to keep for the clients. Since the couple are having separate counseling, a counselor cannot disclose that information to the other. Confidentiality needs to be addressed with clients with informed consent. Potential consequences of each action and how I determine a course of action. If I take the course of action of assuring the client that their confidentiality is safe and what is said in counseling is not shared, they may sue the counseling practice for malpractice since the confidentiality is breached since someone else knows that they are in counseling. The actions that will not work is trying to beg the client to refrain from suing the malpractice. Another action that would not work is firing the receptionist when the counselor can remind the receptionist that there needs to be confidentiality for next time. I decided to discuss what occurred with each client, as saying that they do not need to relay messages to the receptionist to give to others. I will also assure both of them that their information that is said in counseling sessions will not be shared. If they try to sue me for malpractice, I will make sure to document all the actions taken by the receptionist and what the counselor did to try to resolve this issue. I'm going to make a part 2 of this video